The problem is that patients take, as most providers well know, at least 6 or more medications, 5 to 6 medications. And that's primarily evidence-based driven, but it's also based upon patients' comorbidities. Patients, we know with heart failure, carry a large burden, comorbidity burden, of like at least 5 or 6 chronic conditions which require some form of treatment. Now, I did state that patients take between anywhere 5 to 7 typical medications. That does not include prescription medications that does not include over-the-counter medications or herbal supplements. So that's something else to take into account. We know that when you increase the number of medications beyond 7, you increase the likelihood for an adverse drug-drug interaction or drug-disease interaction to occur about 82% of the time. So what this basically provides for clinicians is we don't expect them to know every single drug, but it's an excellent reference with regards to, what do I need to look out for if my patient is taking one of these medications and has heart failure. We learned this in school. However, physicians and providers need to directly ask patients point blank, what over-the-counter medications are you taking? What herbal supplements are you taking? You would be surprised at the number of individuals with heart failure who still take ibuprofen or naproxen, which we know, as you well know, because of the effects on the afferent arteriole and within the distal tubule, it has an increased reabsorption of sodium, which water follows, leading to edema, which leads to an exacerbation. And we know that. Most providers know that, but patients don't. And so they think they don't know the difference sometimes between Tylenol and a non-steroidal. Even my own uncle, who has stage D class 4 heart failure, was taking naproxen until he heard, with regards to this particular clinical science statement. And then the other thing comes with medications that contain a large amount of sodium. We educate patients on how to read labels on foods, but we don't educate them sometimes on how to read labels on over-the-counter or other medications that they can get over-the-counter, like herbal supplements, that they have to look at. Does it contain, again, sodium? Does it contain ibuprofen? Does it contain pseudoephedrine, which we know has an effect upon afterload, and therefore, again, it can worsen some patients' heart failure.